Well, we are back here at Tri-Cities Gastroenterology in the Center for Digestive Wellness, and we are joined by Dr. Stephen Fry talking about a problem today that a lot of people may be living with, that there's actually an easy fix, and that's trouble swallowing. And Dr. Fry, you were saying for many people, this could be pretty common.
Yes, the term is dysphagia, and that means just difficulty with swallowing. And what we'd like to talk about is the sensation of food getting stuck or hung up in the chest as it goes down. It's really quite common, and a lot of people just seem to tolerate it and don't think that there's anything significantly wrong or seek attention to get it better. But it can often represent something like inflammation from acid reflux, or an actual mechanical narrowing such as stricture or a ring. And in some cases it can even represent a cancer. It certainly requires evaluation, and typically the first thing that's done is after consultation is an endoscopy, and oftentimes with endoscopy the problem is solved with dilation. Dilation is a process of actually putting an instrument down to stretch the area that's narrow, and in most cases the patients can have relief of their difficulty instantaneously.
And so you were saying for many people living with this problem, and sometimes you said they even get so used to it that they sort of self-treat themselves, but there is help and they get that instant relief.
Yes, a lot of people just over time will learn to chew their food better and better, or just avoid certain things. I see people that just say, I don't eat meat because it gets stuck in my throat, so I avoid meat, I avoid bread. They drink lots of liquid, and they're usually the last person up from the table. And in some cases, unfortunately, they even are unable to clear the food bolus, and they have to either get up from the table or go to the restroom in the steakhouse and actually bring the food item up to clear it. And when those kind of things start to happen, sometimes serious complications occur with that activity.
And of course you hope that it can be easily treated, but you said sometimes it can be kind of serious. You mentioned cancer.
Yes, esophageal cancer, which is an increasing type of cancer in the U.S. associated with acid reflux, can present this way. And so when somebody comes into our office and describes this sensation of difficulty with swallowing, we consider it an alarm symptom, and we go straight to endoscopy to not only to fix the problem, but to make sure that there's not a cancer present.
And Dr. Fry, you also mentioned that if this problem continues and you don't get it treated and you don't get it checked, it can be pretty serious too.
Absolutely. Oftentimes this is related to acid reflux. There is another disorder called eosinophilic esophagitis, which is a allergy-related problem with the esophagus. Both of these things, untreated, result in progressive stricturing of the esophagus. In some cases, people don't actually have symptoms of reflux, and yet they still have severe reflux that's just not being treated. So again, endoscopic evaluation and proper treatment is the way to go.
So really, and I think you kind of know if you're that person that it's something that you're seeing over and over again and it's been going on for a while, it might be time to come in and at least have it checked out.
Absolutely. I think oftentimes we see patients, and probably a little bit more often men than women with this, they eventually come in at the urging of their spouse or significant other that's tired of watching them go through this, but it's wise to have it evaluated as soon as possible.
And it sounds like in many cases it can be life-changing when it's fixed.
Absolutely. Again, patients that do seek evaluation and treatment, they always tell us, boy, I wish I'd had this done a long time ago because it was such an easy thing to get fixed.
Wow, well, certainly an important topic. Dr. Fry, thanks so much for having us out today.
Thank you very much.
We want to let everybody know if you have questions or you think that you might be a good candidate to have this looked at, you can always give their office a call. You can always check out their website as well. That address is right there on your screen. The preceding portion of Daytime Tri-Cities was sponsored by